Megan Warman, and I'm a physical therapist here at Loudoun Sports Therapy Center, and I also happen to be a vestibular certified specialist. I wanted to go over a few things with everyone today as far as these terms that I have written on the board. So I have a lot of patients that describe things using these terms. So the first term is dizziness, and then the second term is actual vertigo. Dizziness is pretty much a catch-all term that means a lot of different things. So first thing first, dizziness can mean lightheadedness, it can mean unsteadiness, it can also mean vertigo. So when somebody comes in and describes the word dizziness or uses it to describe their dizziness, I kind of have to break it down a little bit to try to figure out really what's the source of that symptom. The biggest thing first is a decrease in blood pressure. So a lot of times when you're sleeping at night, you're kind of in that steady state of lying down for several hours. When you get up in the morning, if you are woken up suddenly by an alarm or you're just really used to getting up very quickly, you may experience what we call dizziness, but in respect to lightheadedness. That means your blood pressure actually drops after being in a laying down position. You get up very quickly to jump out of bed that morning and you get a little bit lightheaded and almost like, I use the word whooshy. And that's pretty much because your blood pressure has just dropped after moving very quickly. The other thing is, it's a very common side effect that you'll see on a lot of cardiac medications. So if you're taking medications for blood pressure, if you're taking them for any kind of cardiac arrhythmia, and also if you're taking them because you have heart disease, a common side effect is the word dizziness. And then again, that also means sort of like that lightheadedness, also at risk for losing balance and falling. The key thing with that is when you get out of bed in the morning or change positions, you actually want to change very slowly to make sure that that blood pressure doesn't change very rapidly and you don't get as lightheaded. And then just general lightheadedness. A lot of people just think that that means dizziness. So if you're just lightheaded and you're moving around too quickly, or you bent over and you get up, or you went on some ride in a theme park and you get dizzy, that's kind of where I put that terminology over on that side. The other thing is vertigo. Now, vertigo is actually a specific name for a symptom that means spinning. So whether it is you feeling like you're spinning or the room is spinning, that actually means vertigo. So I see a lot of patients, because I'm a vestibular specialist, that come in that actually have vertigo, where the room is spinning or they perceive that they are spinning. Either way, still vertigo. One of the common conditions that I treat is the BPPV here. That stands for benign paroxysmal positional vertigo, and that is an inner ear disorder that involves crystals, or ear rocks as people like to say, that are found in the inner ear, which belong there. And what happens is when they are in the inner ear, they're found in this little pouch. For some reason, most of the time it's no reason whatsoever, those little ear rocks or crystals actually break off of the gelatinous material that holds them together and then accidentally goes into these semicircular canals, which are 3 canals that are right next door to that. When that happens, you're not even usually aware that it's even happening. When you do realize that something is wrong, that's when you roll over bed in the middle of the night, you may bend over, you may be even at a hairdresser in your own shower, tilting your head back. Because of that change in movement, those rocks or crystals actually move in the canal and it sets off a reflex. This reflex sets off your eye movement, which is called nystagmus. So in regards to the word vertigo and spinning, the reason why you're perceiving the room to spin or that you're spinning is that when this reflex gets set off, your eyes actually have nystagmus, which is a fancy term for eye movement in a rotary component. So I see a lot of that. So I just really wanted to make sure that people understood the difference between the catch-all term, which is dizziness, which can describe many different things, and the other thing is vertigo. If you're experiencing any of these things, obviously you want to take a look at the medication that you're taking, I should say. You also want to take a look at when it happens. Is it just happening when you get up in the morning? Is it happening more frequently than that? Because those are things you would want to bring to your doctor. But if it's something like spinning and it's vertigo, I'm definitely there for you to treat and help you get through that. It's very easily treatable, especially if it's BPPV, and it only takes a few sessions coming into the office for me to take a look at it. Lots of people get this problem. They pretty much will put it on the back burner, kind of wait and see what happens. Sometimes even go to a physician. The physician may give you a prescription for an anti-vertigo, which is an anti-vertigo medicine. It only helps with the symptoms. It doesn't solve the problem. And so you're more than welcome, if you're experiencing these symptoms, you just don't want to wait. I can handle this for you and help you through it. You just give us a call and we can get you in. We do not require a prescription because we're considered a direct access facility. So remember that next time. If you're on medications, be wary, talk to your physician, or if you're room spinning, then that's something I can definitely help you with.